Hello everyone, this is Dr. Vitero from Smile24 Dentistry, and today I will talk about why do we need to place crowns on our back teeth. One reason is because most of the tooth structure on the top of the natural crown it's broken or it's probably decayed, and after it reaches to a certain point, then the best way to do is to put the crown to protect that surface. Another reason is if you have a root canal on those back teeth, we call them the posterior teeth, which includes the molars and the premolars. Those teeth are meant to chew food. So if you have a root canal, the tooth already becomes weaker because of nerves and blood supplies, so it becomes like a shell. So when you have a root canal, the tooth becomes more fragile. So when you put the crown basically grabs the tooth on all surfaces around, and it provides a better protection. It does not guarantee that the tooth's not going to break as well, but it will probably provide the best protection you can do for your tooth after you have a root canal. That's why we strongly advise, especially on the back teeth, if you have a root canal, put that crown on it. It's a matter of time when the patient will break that tooth. It could be just simply by chewing on a piece of bread that it will cause the fracture. And sometimes those fractures can go all the way to the root, so the only thing you can do is to extract the tooth. So preventively, if you have a root canal on the back teeth, put that crown. Otherwise, it will be one of those days you'll be on vacation, or it will be a holiday, and you will most likely break that tooth. It's just a matter of time. So the process of making a crown includes prepping the tooth. So what we do is the dentist will go around the tooth, it will prep the tooth in a special dimensions for the particular crown that has to be placed. And we take an impression of the prepped tooth. Usually we use nowadays digital scanners that it makes things much easier, and we scan it and we send it to the lab. And before you leave the dental appointment, we put a temporary crown which will protect the tooth while the final crown is fabricated by the lab, is designed and fabricated by the lab. So you will go home with a temporary crown, which means that you got to take care of that temporary crown. It's not as strong as the permanent crown, and it may come out. So it's advisable to follow the instructions when you get the temporary crown. Don't floss too hard, just be very gentle, pull the thread on the side, and just kind of wait for a couple of weeks until you get your final crown. Right now I wanted to discuss with you why we need to place the final crowns on your teeth within a time frame. So come over here and I will show you. We have a case here that we're going to be delivering 4 crowns, and usually it takes about 2 weeks for the laboratory to create those crowns and to be delivered back to the office. Patient usually goes home with the temporary crowns, but it's very, very important to come back in this period of time of about 2 to 3 weeks to get their final crowns. And the reason why is first of all, the temporary crowns, they can fracture, they're not very strong. And if they do fracture, and if you don't come on time for your crowns, the teeth may shift a little bit and the crowns would not fit, and then you're gonna have to get a new set of crowns, and it will be more costly and there will be more work involved. So very important, make sure you come on time to your appointment for the crown deliveries. Otherwise, the crowns may not fit. Have a wonderful rest of your day.